So we'll start. So yesterday we finished about norepinephrine and dopamine, isn't it? So next drug belongs to the drug that reduces the blood pressure. So I have been given one drug to deal with. It is also called as antihypertensive, means that the drug that reduces the hypertension or blood pressure. So I have been given to deal with a drug called as labetalol, Labetalol, labetalol. What is this drug? It belongs to non-selective beta blocker with alpha-1 blocking activity. That means, yesterday I told adrenergic receptor, there are two types, alpha and beta. Alpha again two types, alpha 1, alpha 2, beta 1, beta 2, beta 3. So as far as this drug is concerned, only I will deal with what this drug acts. Now it is considered a blocker. So agonist or antagonist? Antagonist. So consider this drug alpha 1 receptor in the blood vessel, beta 1 the SA node of the heart, beta 2 also it has, that is you can tell in terms of bronchial smooth muscle. Now before I go, here let me tell what is happening. If an agonist act on this, vasoconstriction, increase BP. If agonist act on this, increase heart rate, force of contraction, cardiac output. If an agonist act on this, bronchodilation, you can breathe properly. Okay, keep this in mind. Now labetalol is available in the market with other names like normodine or Trandate. It is available as oral tablets also and IV injection also. Okay. Now how does it act? Because already we told here alpha 1 blocking and beta blocking. It is blocking. So you have to reverse the action what I written on the board. By blocking the alpha receptor, mainly the arteries, it reduces peripheral resistance and decrease BP. You know what is preload and afterload? You know what is the meaning of preload, afterload? No idea. So this is the heart, this is the vein, inferior vena cava, superior vena cava, and this is the aorta, isn't it? If the pressure increases from the vein behind the heart, this is called a preload. Load of the heart is increasing. The pressure increases here in the artery, it's called an afterload. So BP can be increased, either maybe increase in the preload or afterload or both. But this is dilating the arteries, so decreases preload. If you constrict here, what happens? Suppose you constrict here, it will come back, the load will come back to the heart. So dilated it, relieved, the pressure is relieved. So because it is, now if a drug dilate the arteries, that reduce afterload. On the contrary, if a drug reduces this one or dilates the vein, it reduces what? Preload. Understood now? Some drugs reduce both, but this drug is mainly reducing the afterload. And I told it also blocks the beta receptor. Mainly beta 1 being concerned here, beta 2 will tell later. By blocking the beta 1 receptor, reduce the heart rate. Beta 1 is present in the kidney also, beta 1 receptor. So if this gets stimulated, beta 1 in the juxtaglomerular cells of the kidney, then there is a conversion of angiotensin Gen 1 to angiotensin 2, angiotensin 1 to 2, and this also increases BP. Plus there is also retention of sodium and water due to aldosterone mechanism. So because you block the beta 1 receptor here only, understood how it acts? Beta 1 it blocks in the heart also on the SA node. So reduce heart rate, reduce force of contraction. Beta 1 blocked in the juxtaglomeralar cells of the kidney also. So because of the renin-angiotensin system gets blocked, so contribute for reduction in the BP, and that's why the cardiac workload can get reduced. The heart is pumping without much effort now. Previously, because of the increase in preload and all, it was working against the pressure and having full of stress. Now it is working without stress, pumping the blood. So what is the indication of this labetalol? Chronic hypertension for long time, maybe 5 years, 6 years, 10 years, patients are suffering. So especially in pregnancy, it is safe drug. There are some antihypertensive should not be given in pregnancy, but this is a drug which is safe in the pregnancy. Hypertension, emergency urgency, last time I told, 180 by 100, end organ damage. In that condition, it is fast acting, they give in intravenous form. Pheochromocytoma crisis. I told pheochromocytoma is tumor of adrenal gland. So, if this is the adrenal gland, the release of adrenaline, because the tumor is there this much extra, so extra hormone is produced. That is one which is causing the increase in the heart rate and force of contraction. And also this adrenaline can act on the blood vessels, cause increased BP. So in this condition, we can use this labetalol, control BP without reflex tachycardia. What's the meaning of reflex tachycardia? Do you know the meaning of reflex tachycardia? No. See, now this is the heart. And here I write SA node. And here I write alpha 1. This I write as blood vessel. Right. So I block the alpha 1 receptor in the periphery. So blocking alpha 1 receptor, what happens? There is decrease in BP. When there is decrease in BP, you have something called as in the aorta and the carotids, baroreceptors and chemoreceptors. You have heard this. Baroreceptor responds to change in the pressure. Chemoreceptor responds to change in the oxygen concentration level in the blood. So because the blood pressure falls, the baroreceptors in this aorta, they get stimulated and they send impulse to central nervous system telling that the BP is falling, please do something, and suddenly there is reflex sympathetic stimulation, and because of that it stimulates SA node, there is increase in heart rate. So because there is a decrease in BP, on the contrary and reflexly there is increase in heart rate, this is called as reflex tachycardia. Suddenly BP is dropped, but whenever reflex tachycardia, there is an increase in the sympathetic nervous system function. This should have come and increase the BP also, because already give the blocker here, it cannot come and act here. But this is not blocked. Because SA node is not blocked, it can cause reflex tachycardia. But this drug blocks SA node also. It is blocking the alpha 1 also and blocking the beta 1 also. That's why when it comes here, it cannot act here. So there is no reflex tachycardia. Now you may ask, what is the significance of this? So anyhow you want to reduce the BP, you reduce BP. If you don't block the SA node also, the patient already is having some condition of increase in cardiac stress, like in case of angina pectoris, next topic I am going to take. In that case, heart rate increase, BP is down. It will again put stress on the heart. But this drug is having beneficial, blocking both SA node also and alpha 1 also. So there is no reflex again. So that is advantage. Post-operative hypertension, short term you can use. And aortic dissection reduces BP and shear stress, because you have to find out on homework what is the meaning of aortic dissection. Find out from the Google. How to remember this? You remember this uses PEACH, P-A-C-H, pheochromocytoma, eclampsia means seizure or fits during pregnancy, aortic dissection, crisis, hypertensive crisis, and hypertensive urgency in emergency, you can use this labetalol. So labetalol is nothing but it is both alpha and beta blocker. Right? Next, come to dose and route. Anyhow, IV bolus, IV infusion, oral can be given. So this is the dose and this is the notes. Repeat every 10 minutes if needed. Titrate to response, and this is for maintenance. Oral I can give for long time. Come to adverse effects. Remember the pneumonia, blood fall, bradycardia, because there is no reflexive means it is bradycardia, decrease in heart rate. So bradycardia, lightheadedness, orthostatic hypotension. What is that? Last class I told you. Orthostatic hypotension. What is the meaning of that? Orthostatic hypotension. And what is the one more name for that? Not studying. Forgot. Frankly, tell how many of you forgot? What have you heard this? What is it? Forgot? If you tell yes sir, you forgot, I will tell again. Otherwise, I will go to next. Forgot. Now at least you remember. Postural hypotension, orthostatic hypotension or postural hypotension. Patient has taken the drug, suddenly he stood up. There is a rapid venous pooling of the blood. The blood is going towards the gravity, so blood flow to the brain gets reduced and patient may fall. Here is the way. So rapid pooling of the blood down. Usually alpha blockers will cause this orthostatic hypotension. Sudden derivation of blood vessels, the blood will pool down to towards the gravity down. So blood flow to the brain gets reduced and patient may fall, giddiness. So that's why you call postural. And I told you, tell the patient to take the drug and go to sleep. After you don't go to washroom, I told examples like he will get fracture. So postural hypotension also is orthostatic hypotension. So when he stands up taking drugs, he may suddenly fall. Especially elderly people or old people, you should be very careful. Obstruction, it was a bronchos. Why bronchospasm? You should know why bronchospasm. First chart only I showed you. Beta-2 receptor is present in the bronchial smooth muscle. Stimulation causes bronchodilation, blockade causes bronchoconstriction. So patient has breathlessness. Be blocked. So that means you should be little careful when you give a patient has both hypertension and asthma. He has hypertension, BP will come down, but asthma will aggravate. Understood? Then drowsiness, fatigue, altered liver enzymes, loss of appetite, lung spasm. Actually, lung spasm and bronchitis, these both are related. So I want you to remember this BLOOD. That's enough. Remember blood loss enough. You will get fine. Means here he feel like this is related to this. Drowsiness, fatigue. Or he feels that something is not there in the upper part of the body here. He feel very lightheadedness. He won't feel because of the vasodilation. Even any drug which causes vasodilation also causes headache. Headache. Usually vasodilation causes that. Now, this drug is not given for you. Still, I have to give. Why? You know, this drug is the king of beta blockers. Means he is the leader. Prototype, propranolol. Now what is the difference between propranolol and labetalol? You know they block, this drug blocks alpha, beta and beta 2. This blocks only beta and beta 2. Alpha blockade is not there. Alpha blockade, yes, no, correct? Use in pregnancy, this is safe, should not be used. Used in COPD, both are not, should not be used, but this is little safe than this. This causes extreme bronchoconstriction, but this also causes, but little safer than this. Beta 2 blockade in the bronchus causes bronchoconstriction, but this is having more broad effect than that. Then emergency use, you can use in hypertensive crisis. This is not used because you are in emergency. You can use labetalol. This has low CNS penetration, so sedation, all this is compared to less compared to this. This will also cause like nightmares, bad dreams. If you take this drug, it causes bad dreams. This will not cause because of the crossing the blood-brain barrier. This is long half hours, 5 to 8 hours once you give the drug. This is 3 to 6 hours. Oral, IV, only oral. So for emergency we use IV. So that's why this is having. Otherwise, propranolol is one of the so commonly used drug. Even though it has lots of disadvantage, even today propranolol can be used for more than 20 conditions on an average. Propranolol can be used for more than 20 conditions even today, despite of disadvantage. But you will see its adverse effects and pregnancy. Labetalol, emergency. Hypertensive Antianginal, labetalol can be used and it's a little safer. Next group we are going to study about anti-anginal drug. Anti-anginal drug. Have you heard disease called angina pectoris? Have you heard a disease called angina pectoris? Have you heard? Anybody? Not heard? See, angina. We have two words here: angina pectoris. Angina means a kind of tightness in the chest region. Tightness you feel, suffocation, uneasiness, or like breathlessness. Where? In the pectoral region, which is this is called pectoral region. Pectoral, usually left side. The pectoral is pectoral. So a kind of chest tightness, feeling of suffocation, breathlessness, especially the left side pectoral region. That's why we call it as angina pectoris. So those drugs which reduce the symptoms of angina or try to give relief from angina, they are called anti-anginal drug. Now you have seen in some movies that either a girl or a boy will tell his or her parents that I am going to marry the boy or girl I like, I don't want your selection. Correct? But parents are not happy. But that boy or girl are very stubborn. No, we are ready to leave you, but I will not leave that boy or girl. And suddenly you have seen in movie that either father or mother will hold the chest like this. Drama. Have you seen that? The director don't know that this is angina. Now you know what is that. Why that father or mother hold the chest like this? Now that is because of they want to show that I have got chest angina. And suddenly you saw in some movies they go and take one tablet, or in the hospital tablet is little far and they are trying to hold it and full background music and the tablet will fall and they you see in the movie, that is this only. And suddenly they take one tablet and keep below the tongue. Try to emergency. Some people are carrying always in their pocket. I tell you what is the drug. That is the anti-anginal drug. Rapidly within no time it reduces symptoms. Understood? What is angina means now? Yeah. Now what is happening here? In angina, chest pain or discomfort caused by reduced blood flow, ischemia to heart muscle, myocardium, typically due to coronary artery disease, CAD. You can see there is a atherosclerotic plaque, fat. So this part of the heart is not receiving the blood because there is a blockage, or your platelet will come and clot there. So pain usually described as pressure, tightness, squeezing or burning in the chest region. Sometimes the pain will radiate up to here, up to middle finger, ring finger and index finger, little finger up to here can radiate, because there is a rule called dermatome rule. There is a common origin of the that part of the body during embryological development. So when the pain starts, pain can radiate. Patient exceeds sweating, breathlessness, as if he is going to die. So all the symptoms, what really occur is disease. That is drama. Movie one was a drama. But sometimes, even if they are a patient of that disease, and because of extreme tension or the pressure you give to the parents, this may get attacked also. Already they are having that disease, and you give like this marriage tension. Because of tension pressure, it may again attack. So this can finally lead to heart attack. Now what is happening here? You can tell now only what is the treatment. Now you have to remove the blockade, right? You have to use some drug that reduces the blood cholesterol. You can use some drug that can cause antiplatelet effect, which is that. Emergency, already we studied this, antiplatelet. You can give myocardial infarction, angina and all. Which is the antiplatelet drug? Aspirin. See how it combats. That's why I'm telling you, keep on reading. This is the subject so easy to learn, so easy to forget also. It just runs out of your mind within no time if you don't keep on reading. Whatever I give PPT, every day you should keep on seeing. Okay, so antiplatelet can be used, and because this is a vasoconstriction, ischemia is the vasoconstriction, so use vasodilators. So the blood flow to that area is increased, because if that part of the heart dies, that is, the blood flow to that part of the heart gets reduced, is called as myocardial ischemia. The blood flow to that heart gets completely stopped, and this part of the heart dies, for example, that is called as myocardial infarction. Remember, ischemia means suppose it is a blood vessel and this is a part of the heart, the blood flow to that area gets reduced, called as ischemia. If the completely blockade is there, blood is not going here, and this part of the heart dies, infarction. This I am telling about heart, myocardial ischemia, myocardial infarction. Can occur in brain also. Cerebral ischemia, cerebral infarction can occur in any of the peripheral tissue also, maybe in the leg vessels. Ischemia infarction can occur anywhere. But this coronary artery is the most vulnerable blood vessel which gets ischemic infarction. So your main treatment is rapidly do the vasodilation. So blood flow to this area gets increased. Then remove the blood clot. Try to reduce the blood cholesterol. And now because of, actually it is said that this heart is very selfish organ in the body. Selfish. Why it is selfish? Now heart is telling, I am going to pump the blood to whole of the heart. Yes or no? That means the whole of the body needs oxygen. I am going to pump it. But I have to leave. If I am pumping about 100% pump, before I give to you, I will take for myself. So first branch of the aorta is coronary artery. It wants to extract more of the oxygen, maybe 70% oxygen it will only take. 30% is given whole of the body. Understood? That much selfish it is. I will give you, but I will keep my part. 30% give, so we are leaving only to 20%, 30% oxygen whole of the body. 70% it takes. In this 70%, it will become 69%. It cannot tolerate. For some reason, the oxygen to coming to back to the heart get reduced. It will not tolerate. Start producing this. To significant, suppose 50%. See, in your body 30% not coming. Heart is getting only 50%. Starts producing pain. So further there is a blockade. The heart is having the stress in working. Then patient is starting the pain and sweating, tremors, restlessness. It feels as if the death is in front of him. So that's why we have to immediately treat. And I told what the patient will take the drug, and that drug is nothing but, you can see here. Before I move on to the drugs used, we'll see types of angina. There are 3 types are there. Stable angina. Actually there are 4 types, but 3 are very main. Stable angina, most common, occurs with exertion of stress. Means whenever you go to gym or when you walk, when you climb, then only the pain starts. When you take rest, no pain. That is called as stable angina. Unstable angina occurs even when you are sitting and watching TV, no tension, still pain, mild pain will be there. With minimal exertion, sudden and severe, it becomes medical emergency. Because when sitting also there is a pain. There only when there is working. This is also called as exertional angina. When he exerts, runs, climbs, then only it comes. Otherwise, when it takes rest, no pain. Here, even when he is taking rest, pain is there. The variant angina, also the Prince metal, coronary vasospasm. The coronary blood vessel vasospasm and usually occurs at night. ECG shows ST elevation. You want to learn ECG. So see what is ST. Silent angina, no symptoms. But evidence of ECG shows this is common in diabetics. You also heard there is something called silent heart attack. Night he was normal, had dinner, slept, morning he didn't get up. Silently he got attack. Silent heart attack. Previously, maybe this is one of the reasons for it. Diabetics, no symptom, but he wanted something for ECG and they found out there is some changes. Then you can prophylactically start echosprin. Understood? So these are the 4 types of angina. So what is my thing? In your syllabus they given to deal with nitrates. Example is nitroglycerin or glyceryl trinitrate. All these are 3. Nitrates is the class. Under this we have nitroglycerin. Given sublingual, I told now father will keep below the tongue. Sublingual immediately cause vasodilation and pain relief. It is symptomatic treatment, not the treatment for the disease. So why sublingual means when you keep sublingually, rapidly get absorbed by sublingual vein to system circulation. Within 30 seconds, patient pain gets relieved, anginal pain. So this is the drug of choice and route of administration in emergency. The patient comes with chest pain and you immediately did the ECG, changes is there, nothing will happen. Take nitroglycerin and tell the patient, lift the tongue, keep it below the yes sir, with the saliva. Once the pain get relieved, even the tablets remaining, you can tell the patient go and spit in the wash basin. The remaining tablet can be spit once the pain is relieved, because we don't want the drug also to be there in the body for longer time. As long as pain is not relieved, let it keep under the, let it get dissolved and go to the system circulation through sublingual vein. So nitroglycerin or nitrates, especially the glyceryl trinate, is a drug of choice. Route is sublingual for anginal acute attack, immediate. Whereas long-term treatment, we can use lots of drugs are there, but for your syllabus, what I have been given to deal with diltiazem. For acute attack, what we gave? Nitrates, nitroglycerin. You don't want it to re-attack again, means for maintenance, we have lots of drugs, but for you, I have been given to deal with it. Now, what is this, metoprolol, atenolol? In the same group, even the labetalol came, previous drug. Propranolol came here only, beta blocker. See? Understood? This already we did. And this is also there for your solbitrate. I have been given today. So this long-acting nitrates. What I told glycerol is a short-acting, immediate acting. But to prevent attack again and again, we can use long-acting. The mechanism is same. The duration is different. How does it act? Now once you give nitroglycerin or glycerol trinitrate, it gets converted in the body to nitric oxide in the vascular smooth muscle. This nitric oxide stimulates 1,8 cyclase enzyme, then increase cyclic GMP, guanosyl monophosphate, dephosphorylate myosin light chain kinase chains, smooth muscle relaxation, vasodilation. So because of this venodilation, decrease preload, decrease mitochondrial oxygen demand, mild artery dilatation, decrease afterload, pulmonary dilatation, increase blood flow to the ischemic area. So because of all these three, decrease angiotensin symptoms. That's all. They are mainly vasodilators. More commonly they cause venodilation, is reducing the preload, mild artery dilation, reduce afterload, and they also cause, more importantly, coronary artery vasodilation. So increase the blood flow to the ischemic area. So that's how this nitrate is the mechanism action of nitrates. Now what is the MS situation we are using? Acute anginal pectoris, rapid symptom relief. Because what is the route of administration? Sublingual. Keep it under the, either you can crush it under the mucosa or just keep and enough. Okay. Immediately acts. Acute MI, myocardial infarction I told. Decrease oxygen demand. This you don't have to actually write this. If you want, you can just read this. Only if you write this much enough. Even you can use it in hypertensive emergency, acute heart failure, or even unstable angina. I told the pain occurs even at rest. Then you can use this. These are the roots of this nitroglycerin, or we already told sublingual. There are other routes available for this. IV is there, transdermal patch, like a bandage plaster. You can apply either here chest region. From there the drug gets absorbed. Ointment is there. You just rapid take and rub over the chest area. And spray is there. The spray here. These are the dose and notes again. So immediately if you want, you don't have to go search for spray or ointment and all. What you can do? Tablet, you just keep it few tablets in the pocket, a small box. Then whenever you feel, you can sense when the pain starts. Open it. Immediately rush to your cardiologist, get the ECG done and further evaluation. But if the blood vessel of the heart, coronary artery, is almost completely blocked, this part they remove and they do graft. Bypass surgery, you heard? This one. Coronary artery bypass surgery, CABG, bypass graft. They takes the sample of the vessel from the femoral vein, and that will be here and stitched. Or they also do something called stent placement. So this part has become narrow. Through the vein they send the catheter and they place the mesh like this here. Hollow, and the blood can easily pass through. And they'll start with lifelong aspirin or antiplatelet, anticoagulant, so the platelet when it comes here should not block for this also again. So usually one stents cost maybe around 1.25 lakhs. Good stent. It is available for 30,000 also. If you put this stent, they give guarantee of 10 years, no reblockade and all. 30,000 if you buy, it works, depends. So lots of commercial aspect is there in stent placement. That's why you should always have a health insurance. Lots of treatment are there for this coronary artery blockade. The medical treatment is what I was telling. These are the surgical procedure. This also emergency only. Immediately they do like PTCA. Find out what is PTCA. Full form. PTCA. After doing PTCA only, they are going to place the stent. You can also able to locate where is the blockade by passing the radio opaque materials and take an X-ray and see where is the blockade. And while doing on the heart the surgery, you should be very careful. Because one doctor went to mechanic, bike mechanic. This doctor used to always go in car. Sometimes he used to go in bike. So once his bike got some problem, he went to a mechanic. He usually commonly go to that mechanic, his friend only. Then some problem is there. Can you check my bike? So that bike mechanic says some problem is there in the engine. So just you have to wait for around 2-3 hours. Okay, I'll wait here. So doctor was waiting there. He removed the engine. He just put the sealant and all, changed the oil, and he just fixed it and he started. So the bike started. Then he asked doctor, how much your labor charge and the parts charge? Mechanic told, Everything calculated, then 2600. Okay. And this mechanic asked the doctor, I remember once you told how the engine is like heart for a bike. The heart is playing a role of engine in the body, right? Because it is pumping the blood. And I did repair of the engine of your bike and I charged 2600 rupees. When I come to your clinic, or I have seen so many examples that when you do surgery in the heart, why you are charging 2 lakhs, 3 lakhs, 5 lakhs? Why that much costly it is? Then doctor tell, Arey Baba, your question is very, very good and nice. When you did the engine repair, you did the repair when the bike is on or off, he told. Bike was off because he removed. But I am doing the operation when the engine is running. Can you do repair of the bike when the engine is running? No, I can't. The oil will spill out. I can't do at all. But I did, or I will be doing when the heart is functioning. That's why 3 lakhs. No mechanic can do bike repair of engine without stopping the bike. You have to switch off and do. Once it is done, then you can switch on and see whether it's starting or not. But here, you can't make the patient to die, take out the heart, all the repair you do, and fix it again. Can you start? That's why it is costly. Understood? So not so easy. These cardiac cases, even while doing the surgery or while doing, suddenly it may go for arrhythmia. The rhythm may be lost. Very difficult it is. So cardiologists will face huge, even though they have experienced, huge challenges while doing this, because all the people will not respond the same way with the drugs, or they don't have same anatomy what others have. Small variation may be there. Sometimes vein may be very small. Sometimes diagnosis may be wrong. So many challenges are there. If one life goes means, then the patient relatives will not leave. They don't know what has happened inside the operation theatre. Or you are allowing every whole of the community to come inside the operation theatre. What has happened is only you people know. And how much are you convinced? There was a block, I tried to remove and that happened. No. You have killed. Finish. Then that's why before doing any of these surgeries or these procedures, the patient relatives or the concerned people will have to give consent for each and everything. By the time some heart procedure is over, maybe 100 signatures you would have taken from them. Hospital is not responsible, surgeon is not responsible, we are the responsible, we are giving consent. Even if they go to court tomorrow, let's see, they put the sign here. Because they put the sign, I have done this. Means, I am going to try to save the patient. Something may go wrong, please don't blame me. I am going to try and save the patient. That's because informed consent. You will get a short notes on that. You have a short notes on that. Informed consent. So this is anyway the power gone. And the two drugs were finished. When you start working in the emergency department, you can see on the outside on the table they kept one book, and also inside your the procedure room, some sheets are there. Each and every time you should run out, take the signature, come back and start doing procedure. Run out, take signature, and the patient should be always outside to sign. Unless they sign, you can't proceed. Without the consent, if you proceed and something happens, they will be in court, finished. You will be in the court of law. So, I have experienced this from my brother. Maybe more than 100 signatures they have taken. They did the bypass surgery, everything they did. Stent, 3 stents they put, 3.75 lakhs there. By the time he was discharged from the hospital, for 6 days, they charged around 6 lakhs 55,000. Hardly he survived for 4 months after that. He expired. 6 lakhs 55,000 he paid. 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 6 lakhs 55,0 expired this year, May 30th. February they did that. It was not having adherence to the medicine. Adherence means you should take the medicine on the prescribed time and schedule. But he was very careless. And he also got renal failure. So renal failure means every 3 to 4 days once you should go dialysis. If you don't do dialysis, again they start breathlessness. So you become full weak. And once the kidney got failure means you don't want life like that you feel, because you have a complete diet restriction. And you are drinking the water by measuring. Now you are healthy, even 1 bucket water if you drink also aram se will be no problem. But when you have renal failure, then measure and give. You should measure in the home. Okay, 1 bottle and keep 750 ml per definition. 3 days. Once the body fluid level comes to 1.5 liters more, you have to do dialysis. Otherwise, you can't sleep also. If you sleep, breathless, you have to sit. No sleep. And very difficult to maintain the chart. And somebody should be always with you to observe. That's why better, instead of suffering like this, die on that day only when you get attacked. Within 10-20,000, everything will get over. Go and put the graveyard and mamla khatam. Who will go to ICU, put 100 signature, come back, spend 6 to 7 lakhs, still you will get body only. For what for? I'm sorry, fed up. So I'm telling this, health is wealth. You can earn money. Once health is gone, everything is gone. If a person has per day 100 rupees, healthy. A person has 1 crore but having AIDS, who is better? 1 crore is waste now with HIV. Every day your body physiology is getting weakened, pathology is getting increased. You are suffering. With 1 crore, what's the use? You can't have mental peace, you can't have good sleep. 100 rupees you'll go have a buns or coffee, aram you'll come roam here, again next day 100 you'll get easy, healthy. So that's why from the time you start realizing that health is important, you should cut off all the unhealthy foods available in the market or in the hotels. Junk foods, soft drinks, pesticide associated vegetables and fruits, your Lays, Kurkure, completely cut off. Even drinking coffee or tea in the empty stomach. I have made in my YouTube channel all the health related only. I give lots of information, because now you are having engaged, everything will get digested, and once you start getting older, everything, your body will not support. The strength of the fruits, vegetables and the toxins will remain same. Your body is getting weaker, it cannot handle, then we start suffering from it. Then you will be walking museum of diseases. So unless you get admitted to the hospital, you will not know what is the difficulty, what they face. Tomorrow you will be working in hospitals now. You will be seeing lots of patients and their relatives, and you will be experiencing lots of drama in the hospitals and emergency department. Dramas only. Each and every day when you face this, you remember me. Sir was telling right. Everybody will have one or the other different mentalities. Some will take even death as so coolly. Some will take even small injuries. Oh, I am gone case. One small mistake can be put under the scanner. Sometimes big mistakes can be excused also. You will think, I did such a big mistake, they excuse me, what a nice people they are. Sometimes I didn't do anything, still they can put false allegation. Tomorrow you will be working with your colleagues. They are not your relatives or your friends. First time you are getting reported, first time you are having friendship with them. Slowly, and I have seen many people have come for competition, survive. So you may have to face lots of challenges. Anyhow, I think power may not come. So we'll wind up.